afternoon, and welcome to the first of two recorded informal conversations involving New Mexico Jewish physicians who served with the Indian Health Service. I'm Linda Goff, and I'm the current president of the New Mexico Jewish Historical Society. This project was funded by the New Mexico Humanities Council under the CARES Act to interview 6 physicians who came to New Mexico to serve with the Indian Health Service from approximately 1960 to 1980. We currently have the interviews up on our website, www.nmjhs.org, and these conversations that are going to be recorded will also be available on our YouTube site as well as our website. So today's conversation will focus on Dr. Larry Shandler of Santa Fe, New Mexico, who worked in the field of internal medicine and on the Navajo Reservation. Speaking with Larry is Dr. Noel Pugach, Emeritus Professor of History from the University of New Mexico, who is the lead team member of this research project. Thank you and enjoy the conversation.
Thank you very much, Marcia and Linda. And let me start engaging in a conversation with Dr. Shandler. Is it all right, Dr. Shandler, if I address you as Laurence or Larry? What is your preference?
Larry is my preference. Only my mother called me Laurence.
Okay, so I will call you Larry. Larry, could you give us a capsule biography of yourself and where you were born, something about your parents, married, children, and then we'll get to how you got out to New Mexico. Go ahead.
So I was born in Brooklyn, New York, at Brooklyn Jewish Hospital in 1942, and grew up in Brooklyn. Went to elementary school, high school, and actually college at Brooklyn College. I then went on to medical school after a short detour at dental school, which I found I was not cut out to be a dentist. And I went to medical school in Albany, New York. My parents, my father was born in Minsk and came to the United States when he was about 6 years old. And my mother was born in Brooklyn. Her parents came from Odessa. And she went to public school and high school in New York, in Brooklyn. My father went to school, elementary school and high school in the Bronx, and then graduated from NYU in 1932. My parents met when my father was working as a waiter in a Catskill hotel, and my mother was working in the office as a bookkeeper. And my father worked in the paint industry. My mother was a stay-home mom. They did send me to religious school at an Orthodox synagogue in Brooklyn. Not that they were Orthodox. My mother's family was very secular. They were members of the Arbeiterring, the Workmen's Circle. My father really had no affiliation with any Jewish organization. But the Orthodox temple was only 2 blocks from our house in Brooklyn, and it probably had the least tuition compared to the conservative temple that was about 6 blocks from my house. So I got my initial Jewish education, had my bar mitzvah at Congregation Beth Judah in Brooklyn, New York, but did not have much Jewish affiliation until we actually came back from New Mexico. I went to medical school in Albany, New York, graduated in 1967, and then went to Boston, where I did a year of internal medicine residency at Boston University Medical Center. This was in the time of the Vietnam War, and I was opposed to going into the war, and fortunately was able to fulfill my selective service obligation through the U.S. Public Health Service. And we didn't know much about where we'd go. I was married at that time. I got married in 1964 as I went off to medical school. We knew from a friend of a friend who had been up on a reservation in Montana on the Blackfoot Reservation and showed us a picture of him climbing out of his house from the second story after a snowstorm, that we did not want to be up in Montana. And so we put in for the Southwest, thinking that New Mexico was like Tucson or Phoenix, since I had literally never been west of the Hudson River until I went out to the Indian Health Service. So after a year of residency, and I did not get deferred further for training, I went into the Indian Health Service, and my wife Joan and I packed our car and drove out to Tohatchee, New Mexico, on the Navajo reservation. So that's the background of us getting out to New Mexico.
All right. Thank you very much. Now, what was life like for you and for Joan living out in Tohatchee? And this was all a new experience for you, coming from the East Coast, from New York. What was it like? What were your initial reactions?
Well, you're right. We'd never been out from the West Coast, or the East Coast rather, and our impressions were what we didn't know what to expect. We had done some reading. We had studied Clyde Cluckhorn's book on the Navajo culture, and we drove up to Tohatchee, which is a town located about 30 miles north of Gallup, heading on the road to Shiprock. We drove across the cattle guard that went into this little community. Tohatchee is actually a community of about 4 different areas. There were at that time 2 boarding schools, one at Tohatchee and one across the road, which was called Chuska, for Navajo children who lived more than 2 miles from a bus route. They had to attend boarding school. So they came in late August and maybe went home during Christmas. Did not see much of their family during that time. In addition, there was to the 2 boarding schools, there was what was known as a day school, which was part of the Gallup-McKinley public school system. And then there was the community of Tohatchee, which had a post office, a laundromat, and a trading post, and what's known as a chapter house, which is a meeting place for the Navajo who lived in that district, in sort of a their voting district on the Navajo Council. And within the community of Tohatchee, where there was the post office and other buildings, were about two churches, one Catholic and one Protestant. In the community that we lived in, the Tohatchee, the boarding school, there was a Tohatchee boarding school and the public health community. And there was housing for the teachers and staff at the boarding school and housing for the public health service people, which included a dentist, an engineer who worked on water and sewage problems, and then a health educator, a nurse. And we drove over the cattle guard, and I drove up to the clinic, which has since been replaced with a wonderful modern building, and introduced myself. And this was 4 days before I was officially to report. And the doctor who had been there prior to me had not been happy in Tohatchee, and for the last month of his stay, refused to see any patients. And the nurse said, "Can you see some patients?" And I was very anxious about doing that. We saw a few patients, and then we got back in the car and we headed over the border to Holbrook to hide out over the 4th of July weekend until I could officially report on the Monday the day following Independence weekend.
So, now, you treated only Indian, Native American patients. Was there a restriction, or were you able to treat others as well? And I guess they were both Navajo and Zuni, I think.
No, we can only treat Navajo. There were some non-Navajo Native Americans who worked in the boarding school, but Indian Health Service could not treat those because they were off their own reservation. And that was sometimes a point of conflict with some of the folks that worked at the boarding schools, because they did need to go into Gallup and see non-Indian health providers for their medical care.
How would you, what roadblocks, what difficulties did you encounter in treating the Navajo? I guess one would be language, and the other would be cultural. So would you comment on them?
Yes, well, language was a problem. I only learned a few words of Navajo. I did have a nurse who was Navajo, who was my translator. Sometimes that became difficult if we were talking to some older male patients who would not like a woman to be interpreting in the conversation. And we did try to be very respectful, or I tried to be very respectful of traditional Navajo beliefs. And the Navajos, however, were very easily to treat because they would divide their illnesses into what were Navajo illnesses and were treated with ceremonials or sings, or what were Belagana or white man's or blue-eyed, and where they would come in for a treatment with me. We did try to be very cognizant of their beliefs. And for example, we had a tragedy at the clinic. We had a maintenance man who was working under the clinic to work on some electrical things and unfortunately was electrocuted. We pulled him out from there, and though he was obviously deceased at that time, I did try to do some resuscitation so that he would die outside the building. Navajo culture says if someone dies in the building, that building is abandoned. And I did not want the clinic to feel that it was a place that was chindi or not sacred anymore to Navajos to come. So we were cognizant of their beliefs, and when it was a situation where Navajo medicine was the right treatment, then that's where we went. Other problems were that I did not have a lot of training in a lot of surgical problems and trauma. I had no real training in pediatrics. And there was, so I often, particularly when I first came out there, would have to call into Gallup to speak to some of the specialists there. And often early on in my career, sent people into Gallup when in actuality was not necessary because they were simple things to deal with, but things that I was unfamiliar with. And in one of the Navajo papers, not the Navajo Times, the main paper, but in one of the other alternative papers at that time, there was always a cartoon of a doctor with his stethoscope on a patient and his eyes on the textbook, thumbing through it, trying to figure out what to do for this patient. So the Navajos, in their great sense of humor, and one of the things that made it easy for me is that I enjoyed and I have their sense of humor. So it was very easy to understand when people had comments that one might take offensively, but I found very humorously. For example, the first time I removed a tick from someone's ear, I struggled and struggled, and I finally got the tick loose and out. And the Navajo lady, an older woman, turned around and speaking to the translator, my nurse said, "That must have been a really big tick because it took me so long to take it out."
Could you give our listeners a frame of reference? When did you arrive on the Navajo reservation, and when did you leave?
We arrived in July of 1968, and we left at the end of June in 1970.
Okay. Could you comment on how your Jewish upbringing affected, influenced, or helped shape your approach to dealing with the Navajo?
Well, I think the sense of, particularly from my mother's family, of the sense of doing good and helping others. I guess you can say tikkun olam, but I didn't know those terms at that time. Was a sense of we're helping these people, and also learning about it. I think what triggered more of a sense of Jewish identity was the fact that for the first time we met many people who had never met a Jew before and had no idea of why we didn't believe in Christ. Even though we were Jewish, some people even having other stereotypes, not in a negative sense, but just from a lack of knowledge. And so that awakened a sense of identity and Jewishness in us. We did have many of the other physicians who were out there, not on the Navajo, as well as some of the attorneys who worked for the Navajo legal offices who were Jewish and who were from either the East Coast or the West Coast. So we could put together a little Jewish community, but I think the fact that we had to do a lot of explaining to people who've never met Jews made us want to become more knowledgeable and strengthen that identity.
And I understand that when you came back to New Mexico, you got involved in Temple Beth Shalom in Santa Fe, became very active. You and Joan became very active.
Yes, when we left the Navajo, we went back to Boston to complete my training. By then I had switched specialties where I had done an internal medicine internship. I decided after spending 2 years with a great number of kids and their families indirectly that I wanted to go into pediatrics. So I completed my training in pediatrics and then decided that I wanted to come back to New Mexico. And so we settled in Santa Fe. I took a position with the New Mexico Department of Health. And one of the first things we did, because my wife wanted to be sure that, and I did too, wanted to be involved with the organized Jewish community, is we actually hunted down the rabbi who was Rabbi Markowitz, who was a part-time rabbi at Temple Beth Shalom. So one of the first things we did when we arrived is be involved with the synagogue. And over the years, we both served on the board. I was president of the congregation in the past, as well as a board member, and still are active and regular service, regular attendees at services. And for many, many years, when we stopped it, we did have a big post first day of Rosh Hashanah luncheon that we hosted here for seems like most, if not all, of the Temple Beth community.
Okay, what lessons did you draw from your work with the Navajo, with your living out in Tohatchee and so forth? What were some lifelong lessons that you learned?
That I wanted to have a career where I could work in a place that allowed me to deal with many cultures, that can help work with underserved people. We learned that we did not want to live in a rural area because they did not have those kinds of things that would sustain us and help us raise our family. So, but I think that the experience was such that I did not want to live in a big city. I did not want to live in the suburb. I did not want to be where I had to commute for a half hour, an hour to work. I wanted to live within a community where I was not only the physician, but I was a citizen, a part of that community. And I could interact with the community, not only in the medical setting, but in other aspects of community life. And that was particularly true within the Jewish community.
What sustained you intellectually when you were out on the Navajo reservation? Hatchery and so forth.
The Gallup had a wonderful librarian, Octavia Flynn. The library in Gallup is now named after her. And she was a great resource for information and books that we could get. We got the New York Times daily mailed to us. There was no delivery to the door, so it came 3 days late. But reading the Sunday Times on Wednesday was okay because we weren't close to New York anyway. And we did form a group, a little film society made up of doctors and lawyers and teachers. This was the day where we actually got the film. I think it came in 16 millimeter. And so we had that cultural activity. For religious activities, there was not much. We had our Seder, which we invited our friends to, and wrote our own Seder. And for the high holidays, we'd go into Albuquerque and attend services at one of the synagogues in Albuquerque.
I understand you told me on an earlier occasion that the Navajos gave you a Navajo name. What do you mean?
They gave me my name as Chischili, which was curly. My hair was thicker and more curly at that time. They actually gave my son, who was born out there, a name of Asakitso, which means big boy. He was a kind of chubby 1-year-old who left. They never told my wife what her name was. She actually taught at the Gallup McKinley County Day School, and we had some families, the Navajo families, that we met through her students.
Okay. Is there anything else you would like to add before we close?
I think that this was, for both my wife and I, a life-changing experience that we didn't expect. We thought we'd be out here for 2 years, and we then come back to the East and settle somewhere. But it changed us in a way that we wanted to be with a much more diverse population than we would have been in living in suburban Boston or New York or wherever we ended up. And it gave us an opportunity to really be outdoors, which became an important part of my life. And Santa Fe gave us that cultural, intellectual life that we certainly could not get out in Tohatchee.
Well, thank you very much, Larry. I wish you well, and Joan well, and want to thank you for participating in this conversation.
It's been my pleasure. And I think the state of New Mexico has benefited from those of us who came out here on the Navajo and other pueblos and reservations because a great majority of us stayed and became part of the medical community throughout New Mexico.
Very good. Thanks again, Linda, anything you want to say to close?
Would like to thank both of you, Larry and Noel, for agreeing to have this conversation. It adds more meaning to the oral interview that was conducted earlier on. And thank you so much. I thoroughly enjoyed it.
Good.
Thank you.
I did too.
Okay, thank you. Bye-bye.
Stay healthy, all of you.
Likewise. Bye-bye.